Over to you.
Okay, ma'am. Okay, thank you, ma'am. Okay, thank you, ma'am. A very good afternoon to everyone present here. I, Spurti Shetty, Research Assistant at Manipal Health Literacy Unit, Prasanna School of Public Health, MAHE, Manipal, India. It is my honor to welcome all the participants from 20 different countries to get benefited from the third webinar organized by Manipal Health Literacy Unit, known as MHLU, in collaboration with Asian Health Literacy Association, known as ALA. MHLU aims to excel in health literacy, resources, policies, and practices. The ALA seeks to understand health level across Asia from a research, educational, policymakers perspective. Collectively, MHLU and ALA are initiating webinar series on health literacy for healthcare providers, researchers, policymakers, industry, academia, and public. Before I invite first speaker of today's webinar, I have some important requests to the participants. Small request to the distinguished participants to kindly mute your cell phone and the mic. You may post any queries or questions during the session through the chat box. We would be addressing few selected questions considering the time limitation. Today's webinar, we will be hearing an insights of expert on digital health literacy in motion and digital health literacy for health, equity and sustainability. Please note, the speakers will be sharing their insights for 15 minutes. Introduce our esteemed first speaker of today's webinar, Mr. Julian Wayne, is a distinguished individual who embodies a wealth and knowledge and expertise in field of innovation, design, and social sciences. Naturally evolving in an international context, fluent in English, French, and Spanish, Julian's deep-rooted passion for social impact, health, and well-being, as well as democratic and environmental challenges, has propelled him to become a true trailblazer in his field. With multifaceted profile, he has garnered the dynamic realms of business both in large corporates and startups. He has also contributed significantly in the public sector and policy-making domain, collaborating with ministers, the European Commission, and public services. Moreover, Mr. Julian has made remarkable contribution in academia, working closely with prestigious universities and esteemed research labs. His commitment to the societal progress extends to his involvement in civil society organization, where he has lent his expertise to NGOs, associations, and cooperatives. As a social entrepreneur, a researcher, and active citizen, Mr. Julian possesses a rare combination of systemic and strategist thinking coupled with a remarkable problem-solving approach for the design, the department, and the implementation of innovation. His company, Malsalma Mind, develops solutions and engagement techniques for the project generating positive impact and a good for people and earth. At an academic level, he is the head of Department of Social and Health Innovation at Prasanna School of Public Health, Manipal Academy of Higher Education, and also affiliated to the United Nations University. He is a member of WHO initiatives ATHAC 80ACH related to the development of low carbon and resilient health system. He is also a member of Planetary Health Alliance. His research activities are related to the digital health transformation, data and AI governance and trustworthiness, digital health and well-being, public health, digital democracy, behavioral science, post-growth economics. Mr. Wayne regularly speaks at international conferences and organizes workshops and training sessions. Now, I would like to request Mr. Julian Wayne to share an insights on digital health literacy in motion. Over to you, sir.
Thank you, Sporty. Actually, I was expected to speak second, so actually my presentation, good morning everybody, my presentation is about digital health in motion. So I will try to share some of the experiences I could accumulate in my career on the development of digital health solutions for different types of patients or citizens. I would try to explain a few tricks and a few methods and models we are using when we develop this kind of tools. So first point I wanted to make, the digital access and the digital literacy in general. I'm not talking about health specifically, but in general, digital access and literacy is considered now as a determinant of health. It's something that is within several publications now. I mentioned one here with this diagram, but this publication, I found it interesting because we see from this article the link between this digital literacy and access with other social determinants of health. And we see that having access to digital, being able to use digital solutions, digital tools, is intrinsically related with the capacity of people to evolve and thrive in their community and in their environment of life. So it's very important, of course, to consider that now we are in a digital society and we need to work on the access of the most vulnerable population to this digital world in parallel of the real world we are all living in. So we have, of course, a problem, a potential problem of digital divide. It's something that has been researched and analyzed a lot. Maybe the fellow professor speaking just after will explain as well this aspect. But I wanted to give some hope as well about this digital divide, which will be resolving in the next years with the development of the equipment in connectivity and access to internet. You can see on the right picture that the level of equipment in different areas is pretty high, above the 50% at least, and rising every year. And in India, if we talk about India, it's already 800 million smartphones in 2022, and we estimate by 2026 to have 1 billion smartphones in India. So it's something very spread developed. The other aspect is that we had a generational gap, but nowadays this gap is tending to reduce because elderly population, a new generation of elderly population are of course more and more tech savvy or digital savvy and are more and more using smartphone or tablet or this kind of devices. We can see that actually a few years ago when the company launched Pokemon Go, this online smartphone game, that actually elderly people were very keen and up to take on this game. We see here senior man in Japan playing intensively to this game, but actually it has been demonstrated through several research. Some friend of mine in Barcelona did an interesting research here to show how it increased the physical activity of the elderly people in their city in Barcelona. So it's something that it's democratizing a lot. Of course, we have as well the devices themselves, which have improved a lot. Of course, the haptic or touchscreen interface are pretty intuitive, pretty easy to grasp. So, of course, it reduces this digital divide. We see as well that other technologies like virtual reality, for instance, are something pretty intuitive for all age, all type of people, digital savvy or not, actually, because it doesn't require any specific knowledge, just capacity to move in the space. And we see more and more of this technology which facilitate the interface with humans. The human-machine interface is every day simpler. We see here the personal assistant by Google, but the same for personal assistant like Alexa from Amazon. These kind of devices are controlled by voice. So obviously, any people who have voice and be able to speak can interact with this kind of device. And of course, this kind of device become more smarter and smarter every day. The latest advance the last month in artificial intelligence. And here on the screen, you have an example of ChatGPT. But this kind of generative AI are as well making this device and these IT systems more and more accessible and smart enough to process natural language and to be able to interact with human without any specific skills. So this digital divide is, in my opinion, every day decreasing, even if it's still a challenge that we have to address. So beyond this digital divide, why it's interesting to use digital to support patients in their increase of their health literacy, but as well globally in the self-management of their condition, of their health. In general and their well-being. It's interesting to observe that digital has kind of superpowers, and it's pretty interesting to look at these specific characteristics of the digital technologies. First, it allows us to go beyond space and time limits because when you are equipped with devices, as I was speaking earlier, like the smartphones, tablet, or these kind of devices, of course, we always wear them with us and keep them with us. And so the capacity to be ubiquitous anywhere we are, anywhere we are developing activities, working, relaxing, doing sport, is possible to have this technology with us, and time limits as well, because of course it's a service which is available 24 hours, 7 days, so there is no problem of time. And we can be time sensitive as well in the kind of messages, and we'll talk about that later. Kind of messages we can pass to the patient. What is interesting with digital as well is very cheap to scale up. The scalability is very cheap compared to other process or other methods to provide care. Of course, it's easy to deploy an app or deploy a website and deploy a digital solution in general to large population, which is interesting for large countries like India. And interesting if we want to reach out a large population. We are all, or not all, but we are, most of us humans, more and more connected via this device I was talking about. We as humans, so we track more and more data from the smartphones, from the smartwatch, as you have in the screen. But actually, if we look at the state of the wearables technologies, so these technologies we embed on our body to measure a number of things, we can see that the state of play is impressive, and we can measure almost everything on our body nowadays in real time, and all during the day, different part of the body. So it's obviously this capacity of collecting so much data and processing so much data, because the progress of artificial intelligence I was mentioning earlier are related to progress in computation capacities as well. And we have increased a lot these computation capacities in the last years and months. And it allows us to create kind of digital twins of the body, of the human body, of humans. Digital twins are not a new concept. It's new in healthcare, but it's pretty old in manufacturing. For instance, we are twinning digitally a lot of machine in number of manufacturing industry in order to prevent the maintenance or the issues that we could have with this machine. Nowadays, we could do the same, or almost the same, to create digital double or digital twin with human, which allow actually to personalize the interventions we will have with the people. So this is another superpower of digital, this personalization capacity. So we are at the same time we are going beyond the space and time limit. At the same time, we can scale up very cheap in a very cheap manner, but at the same time we can address many people and to be very individualized in the messages and the intervention we are providing. And as health is not only a question of parameters intrinsically related with our body and our person, because we have external as well determinants of health that are influencing our health condition. We have as well other kind of technologies which are monitoring a lot of things in our life environment. Here it's a picture representing a smart city, so we can see the different aspects of the city that we can monitor and create a kind of digital twin of the city as well with all these data, which allow as well to personalize not only on the basis of personal parameters and personal data, but as well environmental data will help to personalize the information and the advice we will give to the patient. So it's important to both take into account the individual, the patient, but as well the context of life of this person, to be accurate in the training, education we are providing to these people and advice. Of course, there are some pitfalls and barriers. I mentioned 3 here. We need people, and when I say people, it's both patients and professionals, health professionals, to trust these kind of digital systems. We have to be careful about the question of privacy, and especially privacy on personal data and data protection. And we need to be careful as well on the question of cybersecurity. You've seen recently different attacks on different hospitals in India, but as well in many countries in the world. These data are very valuable, and that's why they are attacked. That's why we need very good cybersecurity systems to protect them. So appeared a few years ago a new concept called digital therapeutics, so the capacity to create a therapeutic recipe based on digital technologies. This strategy has been first taken up by the pharma industry, calling it the beyond the pill strategy. So beyond the manufacturing of drugs, what could pharma industry develop? And digital therapeutics has been one very important trend this recent year to develop digital solution for health, serving the purpose of digital health literacy, and as well globally the empowerment of the patients. We have many models and many digital therapeutics or mobile health app in the market. Actually, more than 500,000 are actually at the moment on the store. Not all are very good, to be honest. Only a small proportion of them have been proven clinically. But the common ground we can find between these different apps or digital therapeutics are these 4 components. A component of content, both informational and educational content, which is related with the question, very related with the question of health literacy, obviously. A series of trackers, usually these kind of solutions are tracking and collecting data every day on a real-time basis around the individual and around the activity and behaviors of this individual. So it is helped by the devices, but the smartphone in itself could be the hub to collect this data. A third component usually of these digital therapeutics is the capacity to coach and to communicate with the patients. I will detail a bit this approach, the coaching approach and the communication approach. And the last component would be a set of different tools and features that could motivate and engage more the patient to realize certain actions or to learn some aspects related to their health condition. So these are the 4 main topics. 1, I pass the information with content. Content could be articles, videos, etc. 2, I collect data to personalize every day better my content and my advice to the patients. 3, I have a lot of communication and interaction with the patient and a lot of touch points. As I said, digital allow 24 hours, 7 days communication with the patient. And 4th element, motivate the patient to support his capacity to act. In terms of content, you can look different formats. I took one example here of different articles or videos that you can watch on your smartphone that will teach you some aspects related to your personal profile. So if I have high blood pressure, for instance, you can see on the left an article on lower my blood pressure with whole grain. This is the kind of advice we can give, and this could be adapted and tailored to each patient. The communication, we can as well develop some strategies for the communication to be able to adapt and to personalize better the messages we will push to each individual, each patient, to design personalized intervention, to use different channels, because not everybody is reading or interacting in the same way. So it could be face-to-face in the real world, but it could be phone call, it could be SMS, it could be pop-up notification in our mobile. It could be many things, and we can automatize as well these kind of interactions with what we call the marketing automation tools. Basically, it's what we are using in the private sector, in the industry sector, McDonald's or Apple are using these kind of tools. And so because there is a kind of war at the moment for the attention, or battle, I would say, for the attention of people from the different brands and different digital players, when we are trying to develop digital health literacy approach or digital health interventions in general, we have to enter in this battle and so be able to use the same tools and the same weapons to compete with these other marketings, which could be negatives, of course. And we have to design engaging message. I put a few advice here. Of course, we have to be closer possible from what we think that the person we have in front will take up in a easier way. I show here a model of communication. Actually, it was done by the WHO a few years ago about smoking. This is the kind of messages that are more impacting than saying stop smoking only, to explain that if you stop now, or if you stop, if you stop now, you will see different benefits in the next years to give motivation to the people. We have to take into account as well, sporty, how long, I didn't measure my time, how long is remaining?
Sir, another 3-4 minutes.
3-4 minutes, okay, I will go fast. So we have to keep in mind that we human, we are not always rational, first point. And second point, we are most of the time working on automatic pilot mode. This is a research from the Nobel Prize, Professor Kahneman. It's already more than 10 years ago, who published this very famous book called Think Fast and Slow, and explained us that most of the time we are on this system one. We have in our brain two systems, basically, system one, system two. One is more intuition and instinct. System two is more rational thinking. Actually, 95% of the time we are using the automatic mode, the intuition and instinct mode. So we have to take into account that. We have to take into account as well the theories on behavior change models. I put here one. This is a Fogg model, BG Fogg in 2009. But to show that we have, so the equation is behavior equal the motivation dot the ability dot the trigger. And we see that this kind of model help us to shape and design the different interventions and the different motivation elements and cognitive resource or other type of abilities that the patient will need to have a capacity to act and not only understand and not only access the information, but as well to apply it, to appraise and to apply it in the real life. We have to take an important as well thing in account, like in e-commerce in general, e-shopping. We need to always link the online and the offline. We all have digital life and real lives. Most of the action we will take for improving our health are in the real world and the real life. So we have to link closely what we see in a digital solution with what is happening in the context of life, in the real context of life of the people. And so this kind of strategy has been very well done by different e-commerce players. We should do that in healthcare as well and copy the good practices on that. I talk a bit about nudges. Nudging is the capacity to influence the behaviors without forcing people. This is very important. Nudges are not mandates. I put it in bold here. We don't have to force people, but we can kind of design the architecture of the choice we are doing every day in order to drive people to certain behaviors. And this nudging concept developed by Richard Thaler and Catherine Stein and others since many years now is very important when we are designing digital interventions. We can leverage on different cognitive bias. We all have, I will pass quickly. We have other models will help us to create and design and shape the different interventions, different messages we will develop. If we work in system one, 95% of the time, we need to use these kind of tricks and behavior change techniques in our messages, both in the content we are proposing, the educational content we are proposing to the patient, but as well in the actions we are proposing them to drive, to engage. We have to use different aspects of the behavioral techniques mentioned here. This is a mind space model developed by Paul Dolan with the government of UK a few years ago for different type of public policies, actually not only healthcare, but actually using this in public policies and public management. I introduced the concept of coaching, which is important because once we have motivated people, we have informed and educated them, we need to drive them to the action, because without action, it makes no sense to educate people. So the idea is for them to change their lifestyle, change their behaviors. And I report here one of the most famous models in terms of coaching called the GROW model, GROW, goal, reality, options, and will. I won't detail this model, but it's a way to set goals, to inform the person around the benefits and the barriers of this goal, to plan the action. So supporting stage by stage or step by step the patient to really engage the action and the change in their behaviors and lifestyle. It's very important. We can use different behavior change technique. I will go quick. Last model I mentioned, the model of maturity in change, the change readiness maturity, if you want. Prochaska and Clemente a lot of years ago, actually in '83, defined this model that we are using a lot. Usually all provider of digital health solution are using that to adapt our solutions to this concept, depending on the capacity to understand for the patient that they have to change some behaviors or some activities in their life. We will adapt as well the type of services and features in the digital solutions. I took here just to finish an example of the French national smoking cessation app, which has been downloaded last year 2 million times. So for the population of France, it's 60 million in total. So it's a large part of the population relatively to the smoking population. And we use these different stages. So you see here the name here in bold of the stage in the change readiness model. And we are trying different techniques with different features of the app. So for instance, here it says in French, but it says the reasons to stop smoking here, this button, and actually basically is to create a journal, personal diary, where people will note the reasons they find very interesting. Here we are talking about the cost of smoking. It's again a nudge to show to the people you are spending so much money every day or every month on tobacco, so you have to really stop. So all these models, I will go fast just to conclude, all these models of behavior change are very different and bringing different elements and techniques. They are very important if we want to be sure to pass from the personalized information and education we will provide to the patient to the actions and plan of action, so coaching and nudging together within the digital features. Thank you.
Thank you so much for your enlightening talk, sir. So let me introduce our second speaker of today's webinar, Professor Dr. Diane Levin-Zamir. Professor Dr. Diane Levin-Zamir is the International National Director of the Health Promotion Department of Aglaid, Israel's largest non-profit health organization. He is full-time professor of public health at University of Haifa and teaches at Tel Aviv University Medical School of Public Health. A founder leader of IUHPE Health Literacy Global Working Group and the Israel Health Promotion Educator Association. She chairs the Israel Health Ministry National Health Promotion Council. Professor Dr. Diane has extensively published peer-reviewed articles, chapters, and co-edited books specializing in health promotion action, research, and policy, including special population in communities, hospitals, and medical digital settings. Her research focuses on cultural appropriateness, media, digital, and population health literacy as PI for the Israel National Health Literacy Survey and scientific advisor for the International Health Literacy Project. She is the co-chair for the Research for the Action Network for the Measuring Population and Organizational Health Literacy of WHO Europe, and she chairs the WHO European Health Literacy Technical Advisory Group and a Behavioral and Cultural Insights, is Associate Editor of the Global Health Promotion Journal, and serves on the International Health Literacy Association leadership. Over to you, ma'am.
Thank you so much. I will share my screen. For a moment, please. I'll be pulling it up again and sharing it again. One moment, please.
Yes, ma'am, visible.
Okay, it is visible. Okay, thank you so
Yes.
much. Okay, thank you so much for that introduction. And I really, really enjoyed the previous presentation. Very exciting to see, and it's just it's lovely to be able to present together. I have not in my presentation spoken about the way in which our institution and Clalit Health Services in Israel has gone forward with so many of the digital initiatives that were mentioned in the previous presentation from Julian. But if anybody would like to learn more how that's put into practice in a healthcare system, a national healthcare system, very happy to share. Actually, we have now launched home ultrasound for pregnant women and home urine testing, and we've also the nudge theory has been also applied in some of our behavioral digital practice. So very exciting that I have the honor of coming after our previous speaker, because what he has mentioned is really being put into motion. But today I will dedicate the next 15 minutes, and I'll try to stay, and I'll do my best to stay to time, to talking about digital health literacy. And I think it's really a nice flow from the previous presentation, because we're really looking to see how people can access all that was presented previously and how they can use it for their health. So, and it's always a pleasure to work with AHLA. The Asian Health Literacy Association is a fabulous association, and I've been so pleased since its inception to be such a close partner and working so closely and feeling very much a part of AHLA. So in the presentation, I wanted to talk, and I plan to talk about digital health and digital health literacy, and why it's important, and to share with you the data that we have from the MPulse study looking at digital health literacy and what our recommendations are for practitioners, for researchers, and for policymakers. And if we have time for discussion, I'd be really pleased to stay on. So just to give you the definition of health literacy that we're using currently, because then we'll be talking about digital health literacy, we're looking at the concept that represents personal competencies and organizational structures. We previously talked mainly about personal competencies, what individuals can do, but more and more we're talking about what organizations can be doing to help people access and understand, appraise, and use information and resources in ways in which they can promote their health. And this has been the new definition that we've used from the WHO Health Promotion Glossary that was launched in December 2021. And it's a very, very helpful definition. And we still think about the health literacy typology, where we're not talking only about functional health literacy, where people have to understand basic information, not only about interactive health literacy, where people are actually more and more, and hopefully more and more competent about being able to express their needs, to ask questions, and to be interactive with the sources of information. But mainly, we're now talking about critical health literacy, the way in which people can be much more cognizant and understand more and more what the sources of information are, to judge them and to see if they're reliable or not for them and their health. And this has been really important since the pandemic, since the COVID pandemic, because so much information or infodemics were really plaguing us. But we'll go into that in a few more minutes. So now, following the previous presentation, I don't have to go into the definition of digital health, because our previous speaker went into it so deeply. But as you can see, we are talking about different types of devices. It's not just information that previously and originally was e-health, but we're really talking about many more aspects of digital health, as you can see. And it's for monitoring, it's for health information, it's for diagnosis and treatment, and for managing chronic diseases as well, not just acute diseases. But we really want to make sure that we're improving patient outcomes. And as was mentioned before, it can be done at a lower healthcare cost if we're effective. And again, we're looking at the e-health ecosystem, because of what was mentioned so eloquently in the previous presentation. I don't have to go into it. We're really looking at 360-degree virtual space now, and it's going to be more and more. This is even before we talked about the chat GCP, and it's going to be even more. The investment in digital health, we're expecting to be more and more from the markets. This is just an example of the European market. I'm not a health economist, so I can't answer questions about it, but we're looking at much more investment. Not all of it will be effective, we know, but we're actually expecting that there'll be more digital tools on the market, and we hope that they will be guided by evidence base. The advantages have been mentioned. It's to overcome distances in the country. In Israel, even though it's a small country, we have distance. We have a periphery. We have a center of the country, a periphery, and we don't have enough of every single medical possibility in every single small settlement, and I'm sure in your countries as well. So it helps overcome distance, language barriers. We're able to get information in real time, and we've developed decision-making tools in Clalit that help the physician and also the nurse to have real-time information when the patient is actually sitting next to them, in front of them. And that's being created by the up-to-date guidelines. It's being created by the digital health record. From what we know at that moment is the stock for pharmacy. So the real-time information is becoming more and more relevant and more accurate. Of course, it overcomes patient-provider barrier. It can expedite the navigation of health services if we use it well, and can be cost effective. We know there's issues of privacy and confidentiality. We're very clear about it with our patients when we do online health promotion and other interventions, how important it is to make sure that we're not disclosing information and not exposing people in a way they don't agree. Credibility, trust, usability is extremely important. Accessibility, it's not all towns and not all areas have broadband, and make sure that we're talking about a common language. And I'm not just talking about Mandarin or Hebrew or Arabic. Even within the digital world, we have different terms and new terms. There's a whole new digital language. So we have to make sure that we're talking the same language. And one of the major challenges we have is infodemics. And the case for critical digital health literacy is so important because of the really widespread of misinformation digitally. If we're looking at TikTok, if we're looking at Instagram, Facebook, and other social media, not all the information that's being passed on between peers is actually evidence-based, and it can be very misleading, and we know, and we've seen it, it can cause health issues if people believe and use the information. So it can be as harmful as the disease itself. It also can be fabricated. Some of the information does not have the individual's best practice and best intentions and best well-being in mind. There can be other intentions, but it does reflect the public's thirst for knowledge and solutions. So we have to be there when the public is interested. And we know that it's going to be, it's starting from very early age. 6-month-old babies are using tablets and smartphones instead of learning how to turn a page. Some of them are trying to just swipe a page in a book because that's what they've seen on screens that their parents are using. And of course, before maybe we could say that adolescents were using the same book and reading the same book. Of course, they're all together or separately on digital devices. So we have to be there where the public is. We're using a lot of digital health promoting aspects in our health promoting programs, doing a lot of transformation, keeping in-person in place, but also digital in place. So the question is, and this was brought up so well by our previous speaker, are we talking about a digital divide? Is there really a digital divide? Or what we're talking now more about a digital development throughout the life course. Why do we call it digital development as opposed to digital divide? Because it's not necessarily black and white or necessarily a dichotomy. Somehow, in some way, everybody, even in the heart of Africa where there's no water or electricity, they are affected by digital development. So we are actually looking at where we are on a health development and a course, and see where we want to promote people's digital health literacy as an asset. and not as a hindrance. So let's talk about digital health literacy as an asset. It's complex. We're talking about the fact that there is not one digital health literacy, even for the individual. There's personal health issues, there's situational that can change, environmental. Personal can be an issue of age, of gender, education, culture. There's individual skills about numeracy and literacy and technological experience. Situational, it could be that people's digital health literacy is different if they're dealing with a health issue as opposed to looking at for some well-being information. And they may want to have in-person exchange as opposed to digital exchange, depending upon the health issue they're talking about. What are the media? What is the media environment? Is it relevant? Is it accessible? Is it protective? And of course, social support. Even for individuals who have more digital challenges, if they have social support and family support, their digital health literacy may be perfect. So it is a complex issue. This is a model that we published in 2018. Years before Corona, and it's just become more and more evident to us as we learned how digital complexity is with us when we went so digital in the pandemic. So in summing up, this is just sum up before we go forward to look at the data. Digital health literacy is increasingly important. It's for navigation, it's for managing personal and family health, it's for interacting in the health system. It is a skill level, it's not knowledge. We're talking about skills that are functional, interactive, and critical. We're looking at social, cultural, and generational context. And we want to make sure our interventions are appropriate and innovative. And of course, we want to keep the UN Sustainable Development Goals in mind so that nobody is left behind. So what are our next steps? In spite of the emerging importance, we also know that we have to have national surveys because we want to know how we're doing. How is the population doing? What can we do on a population level to promote digital health literacy so that we know as a social determinant, as was presented by the previous speaker, that we're acknowledging digital health literacy and health literacy in general as a social determinant and taking into consideration. So it is my privilege to share with you the data we have from the MPOL study measuring digital health literacy in Europe. And of course, I'm here to acknowledge also the tremendous contribution from Professor Jürgen Pelikan, who sadly passed away in February. And he was really the heart and the mind of the WHO Action Network of MPOL from the World Health Organization. And these are all the colleagues who worked and leaded this aspect of MPOL. And I won't go into all the details of this slide, but we're just here to say it's based on health literacy. It's based on looking at different aspects of health literacy, and as an optional package, looking at digital health literacy. The design asks research questions about tasks. Who are the vulnerable groups? Have we validated the measure? What are the social determinants of the health literacy? And do we have recommendations for policy interventions? Because we think data needs to drive policy. We developed the instruments, we validated them, we have correlates to look at them, and the optional packages are digital health literacy, communication health literacy, navigation health literacy, and vaccination health literacy. The design was among people 18 and over. And we validated the data, and I'll just go into what we learned from the optional package on digital health literacy with the 3 minutes that I have left. So the definition that we have of digital health literacy is that we adopted what was in the health literacy survey of in 2019. It's based on a conceptual model, and from basically what was looked at 2012 in the HLS European study, but we're looking at the concept that not only looks at how we're accessing information and helping people understand and formulate and understand and validate information online, we're looking at their ability to formulate and express questions, opinions, thoughts, or feelings when using digital devices, and the frequency with which people use them. So this is a very complex measure, but we looked at the results. So just to go forward, We looked at the psychometrics. We looked at how it's associated with general health literacy. We looked at to what extent it's related to digital health empirically. What are the determinants of digital health literacy? And what's the scope of self-reported use of digital health resources? And what are the consequences? Do we know what's the result of digital health literacy? So I will, just to give you a little bit more of the background, these are the countries that participated, and we had different methodology. There are 29,000 people participated. Okay, and just a little bit of a look into the data. We saw that the more people were financially deprived, we know that they were that their digital health literacy is lower. The use of digital resources is not much of a predictor. Education, apparently not yet, but age is definitely a predictor of digital health literacy. We know that people, that more than 50% of the population is challenged with either very difficult or difficult health literacy, but it depends upon the countries. We also see that the distribution is really interesting depending upon the questions. That where people are mainly challenged is not to be able to understand information, but to judge and to see if the information is reliable, and to whether the information is offered by commercial interests, to use the information and to judge whether its information is appropriate for them. So just to move on, we saw that it was associated with the utilization of family physicians, the utilization of using medical health specialists, and the summary is that it's a psychometrically acceptable measure. It's take one more minute of my time. I know it passed 15 minutes just now. It's psychometrically accepted. We know that it has considerable proportions of adult populations have lower digital health literacy. There's disadvantaged populations who have lower digital health literacy. There's a social gradient. And only in a few countries did we see that there was a significant contribution of digital health literacy to the use of health, but we saw that there was a contribution to behavioral health. And just to sum up then, that there are limitations, of course, when we're doing this kind of study, because there were different methodologies for different countries. We'll be repeating it in 2024 and 25, and that will have much more of a consistent methodology. But we're seeing that digital health literacy is really an asset, and we recommend to policymakers that we need to strengthen digital health literacy and prioritize populations that are more challenged. We need to make sure that we're helping people sharpen their skills in critical digital health literacy. We want to make sure the healthcare systems are helping people to access all the digital tools. We have to make sure that we're quality assuring the health information that is going out, maybe give stamp of approval. We're looking at clear language, and we also make sure that we have reaching specific populations. We have to make sure that we're acknowledging the lack of research. We have to have more research. We want to share the research results and continue to have country, maybe less comparisons, but learning. So thank you so much. And thank you so much for the invitation to be here. And I'm sorry I ran 2 minutes over.
That's okay. That's okay. Thank you so much for educating us on digital health literacy for health, equity, and sustainability. Now I would like to invite Dr. Ruyi Huang, who is an associate professor at ISU University School of Medicine, specializing in family and community medicine, quantitative methods for public health, and cancer prevention. She serves as the chief of the Center of Holistic Medicine and the Center for Meta-Analysis in the EDA Hospital. Dr. Huang is actively involved in promoting health literacy in Southeast Asia as an Assistant Secretary General of the Asian Health Literacy Association. She was recently appointed as the Vice President of ALA to lead young scholars in transdisciplinary teamwork and holistic approach. In 2022, she became a full member of Sigma Z, the Scientific Honor Society, to foster global collaboration and share innovative ideas in science. Today, Dr. Ruyi will be a moderator for panel discussion. Over to you, ma'am.
Thank you for the introduction, and thank you all for joining us today. My name is Ruyi Huang. It is my pleasure to facilitate today's webinar on digital health literacy QA session. We value your participation and would love to hear your thoughts. Feel free to ask questions or share your experience in the chat box, and we may be able to address them shortly. And I would like to thank Julian and Diane for your wonderful and very informative presentations. It's almost impossible to present us within 15 minutes. And actually, when I read the slides and I noticed that for Julian, you talk about cybersecurity and privacy for digital health. And we know in Europe, they already set up some laws to prevent big data that could be misused. So I'm wondering for individual, do you have some advice for us to protect our privacy properly in the digital era?
Thank you, Dr. Ruyi, for this question, which is not an easy one, actually, because it's true that in Europe we have made some laws on the data protection topic and on cybersecurity as well. I would say we have two European acts on these topics, and we are still working on new regulation around that. So the law in Europe around data protection is called the General Regulation for Data Protection, GDPR, and this entered in force in 2018. Basically, what it was saying is that any company, any organization, public or private sector organization taking personal data from European citizens should inform these citizens on which kind of data this organization is collecting, for which purpose, and to ask to this individual to sign or to accept by a positive action, so opt-in, as we said in the regulation, positive consent to collect this data. So it's basically what has influenced in not only Europe, actually in all the world, the development of this cookie notification we all have when we are navigating in different websites, that we are basically accepting all the time, or most of the time, I would say 99% of the time, because if we want to access the service we try to access, we need to click OK to this cookie consent demand. So what I would say, I have a critical view on the European regulation, even if it has been the first one in the world and it has inspired others in California, in Australia as well. So we have different countries in the world inspired by this. The problem of the consent-based data protection is that the consent is not really a free consent in the context of asymmetric power balance between the provider of the service, the company, for instance, Google or other companies, and the individual. So this power imbalance between the user and the provider of the service make the consent a bit inefficient. And we have observed many issues with this theory of consent in Europe, even if last month, for the fifth birthday or fifth anniversary of GDPR, we had the biggest fine ever decided in Europe for the Meta group, Facebook. So it's the first achievement. We have some fines and justice is done, but there are some imbalanced power that are difficult. And at the moment, the question is as well how we will reuse these data. So for the secondary use of the data, these data sets that these organizations, public and private, are creating, how can we access, whether we are a researcher or a company wanting to innovate, how do we access, or policymaker to do a policy, for instance, how we access this data for secondary use. At the moment, there is a big debate in Europe about this question of opt-in or opt-out, because of course these data are very important for the public research to find new treatment, for instance, in the medical field, and it's very difficult. So The question of consent is not the ideal solution. It's a first solution, but we are working on new model of governance involving much more the citizens in the trading and control of their data. Personally, I work on the concept of data cooperative with some colleagues. And the capacity to collectively manage as citizens, as patients, our personal data, which have a huge value. What the other power imbalance is that the fact that data nowadays is a very valuable asset. So at the individual level, it has almost no value. At the collective level, it has a lot of value. So when a Google company or Amazon company or collecting so massive data, big data, of course, they monetize it on advertisement, for instance. So they monetize it to third-party companies or clients. The citizen, the individual, are not receiving anything. So the question is how we can rebalance a bit this power between users, people, and organizations collecting this data. But there is no simple actions, this simple recommendation to address at the moment. The best recommendation is to read the consent request when you receive one, but it's a bit long and written, usually very, very small.
Yes, I totally agree. Thanks for the in-depth reply. And my next question is for Professor Diane. And regarding that, both of you mentioned that digital health literacy could be an asset and recent trend on that ChatGPT. I'm wondering that, in your opinion, how to use it wisely so that it can become a powerful tool for digital health for everyone.
Thank you so much, Ruyi. It's such a pleasure to see you. It's a complex question, so it's a complex answer, but I'll try to be brief. We have to, we were up until now in an era where we were just enjoying as much as possible the new digital tools. And I think up until just a few weeks ago, maybe a couple of months ago, it was the more, the better. And we realize wherever it's going to be contributing, it's really going to be an advantage to the populations who need it. And when we're talking about self-testing, when we're talking about information that's personalized, when we're looking at how we can navigate the healthcare system, and up until recently, I think we're all feeling comfortable with let's do more, and as more that we do, the better. But I think the issue of ChatGPT has become a question. In many ways, it's a very good advantage. I'm hearing some background noise, and if it's coming from me, let me know, and maybe I'll close the microphone and open again. Can you still hear me? Yes. Can you hear me? Okay. Okay. Maybe the background noise is just for me. But with the new chat, I think we have to be careful. I think we can use it for information that we can look at and see if it's reasonable. And I think that's also going to require some sense of skills to be able to judge the information, because we know some of it is wonderful. I've used it to test it out and to check some things that I would know or have researched, and I want to see what the ChatGPT would say, to see if it's something completely different, and then maybe I didn't have the right information, maybe my work wasn't good enough. So I think it's because it's at this point a relative tool. We have to say compared to what? The answers we get, what do we compare it to? Because we know that it in itself says, there is also the chat itself will tell you, I'm doing the best job I can. It may not be accurate. It's admitting to the fact that it isn't. So we have to be careful. And we know sometimes it hallucinates. There's sometimes it goes off on a tangent because it's really based on sources, internet sources and online sources. It doesn't create the information itself. It pulls information and it actually writes it in a way that's appropriate for who they think is asking. You can ask to rephrase it. If it's giving you a very academic answer, you can say, please rephrase so that it's understandable by a 7-year-old, or please rephrase it for marketing, or please rephrase it for a newspaper article. And it's very smart in that way, but we have to make sure that we're judging what we're getting. It's still something that we have to be careful, cautious of. but it's nice to learn from, and it's nice to check ourselves, I think, according to information it's pulling on. I think we have to just be very cautious, but it's exciting in many ways. And I know that some people keep it open. Well, they keep their Google open and other browsers open. They have it open over the time. So I think we all have to decide to what extent we want to use it and for what. And to make sure that we're judging what's there. Is it reasonable? Does it make sense?
Yes, I think so. And thanks. And I think from your answer, we're glad that probably we don't need to think about that we might be substitute for health professionals, because
Yeah.
now people can talk freely with ChatGPT anywhere,
Not yet.
and anytime. So the information need to be cautiously checked, especially we don't know if there's any misinformation or fabrication, something mixed inside.
I agree. We have to watch it, and we have to just make sure that we're acknowledging it. If we're going to use the information, we have to acknowledge it. We have to cite it as a source, so that if we're passing on information from that source, we're actually being, we're disclosing that that's the source, and help others can judge it as well. Thank you.
Thank you for your.
May I have a question?
Yes,
I don't know.
please.
Yeah. Well, is that
Professor
possible?
Peter?
Because I raised my hand. Yeah. Thank you.
Yeah,
I'm
that
Peter
would be
Chan.
the last question.
Yeah. Thank you for both presentation. I have a naive question, maybe to Diane. One of our effort in health literacy is to narrow the health disparity, because we know that when we disseminate health information, provide information to the public and the patient, there was a problem about make it more available, easy to understand, accessibility. But now digital disparity also a big issue, because some people, they are getting good internet, they have a good Wi-Fi, they have 5G, but some countries still using 3G in a very low availability. So how do we making this digital health being able to narrow down the health disparity? Because I know the digital disparity is still a big issue. So I'm wondering how can we approach that? Thank you.
Yeah, it's a great question, and I can give some of my insights. And of course, there's no one answer. And there, firstly, we have to acknowledge that the disparities are there, and there will be. There will always be some disparities. So in my the work we do in health promotion, in the healthcare system, in policy, and in research, we have to firstly acknowledge it and respect it. Respect and we would try to close it, try to narrow it, but we also have to know it will always be there. And firstly, provide people with the resources in ways in which they can access them. If it's telephone resource, if it's face-to-face, if it's face-to-face digital, it's a face-to-face in person. We have to keep all our resources in place so that people can choose what they want for whatever health issue they want. Some people who are very digital literate and media literate, when it comes to something sensitive, a health issue that's sensitive, they might say, my digital skills are not important for right now. I want to sit next to my provider. I want to be in the room with them. I want them to sense what I'm worried about, and I want to hear them face to face. And it doesn't matter that I know how to access them digitally. I need to be in the same room with them. We have to make sure that we're always firstly leaving all of our resources in place, because there isn't any one answer for every person. Secondly, if we want to narrow them, we have to make sure that we're doing something proactive. Are we just stigmatizing and saying, oh, people over 65 or over 70 or 80 don't have digital abilities, so we won't even have them access. We won't even access the tools to them. That's not what we're recommending now. Ageism is not the way to go, because there's some people who are much older and have better digital skills than people who are younger. So we have to make sure that we're allowing people, first, to express their needs, and having interventions that are helping them improve their digital skills if they want to, and it would convince them to, because there's an issue of self-efficacy for digital skills. It's not just knowing how to click, it's trusting themselves and feeling confident about their ability to get what they need, for example, from the healthcare system digitally. So we have to be working in programs, intervention programs, to help people access, to help people feel comfortable use it, to teach how to use it in a way that it's that's compassionate, it has empathy, and if people need social support, that have them encourage them to recruit that social support, whether it's from families, whether it's from peers, whether it's from co-workers. So we have to, it's like any other intervention that we do in public health. We have to make sure we're looking at the determinants, that we're looking at a systems approach to the question you ask, and make sure that we're asking the right questions and working from the answers that we're getting. And I'm sorry that was a long answer, but it's a complex question and it's an important one.
Thank you so much.
Thank you. And I think we have Dr. Rahel who raised their hand. So you are,
yes.
Yeah, you can continue.
Thank you so much. So I think most of my answers have already been answered by Julian and Doctor here, but my question is something related to cookies that are usually accessed by digital. In case I want to register or access into a digital platform where I have to enter some data or seek information on some health related data, there is a mandatory cookie acceptance, which either gives you three forms. What if I am not comfortable with accepting that cookie? Because cookie is basically placing a small bug in your system. So what security does it give me to accept or not accept that cookie to access the data? Where does the free will has to come in terms of accepting or not accepting that cookie is my question. But half of my answers was already what I wanted to answer was already answered earlier, but my question right now is based around this cookie. Thank you so much. Thank you.
Thank you, Rahul. Maybe I can jump in there. It's a bit what I was saying just before. The problem is the power imbalance between you and the provider of the service. If you don't accept the cookie, you don't have access to the service. So is it a real choice? In many cases, no. Certainly not a choice, because you want to have access to this data or to this service, and they will take your data for that. Some providers, digital service provider, are allowing you to access a part of the service if you don't accept the cookie. So it exists as well. So to be fair, some organizations are taking it seriously, and then the guarantee that you can have, or the security you can have on your data, depend on the provider of the service. So some service provider won't give you any guarantee, any insurance. Other will work with technologies that allow to anonymize or to hide your personal identification data and just collecting usage data that are useful for other purposes. So the question is how the provider of services, of digital services, will develop his data management behind the scene in their own data center in the system. But we have privacy enhancing technology, PET, which are available nowadays, which allow to have a clean and ethical way to collect data, personal data from the users of digital services. The only problem is that it's an additional investment for the digital service provider to put in place in their data center this kind of privacy enhancing technologies. And so it's the willingness of each provider to do that. So that's why I was saying the regulations we have around the world around data protection, which are mainly based on the consent concept, will have to evolve towards new generation of regulations that will incorporate as well these guarantees, or to force the digital service provider to put in place different safeguards around around their data collection. I am talking about privacy, but it's the case as well for cybersecurity. We don't always have the information about the cybersecurity system that the digital service provider will use in their data centers. We are not sure. So that's why I believe a new generation of regulation will happen in a few years, or well, actually we are in Europe, we are already discussing them. And it's actually a huge debate and a huge battle between different camps, the very liberals on the free flow of data and the very conservative on the protection of citizens, and in between a full range of positions and political opinions. But it's certainly the way we go, new regulations in the upcoming month.
Thank you so much, Julian, for this answer. I would definitely like to be look into that part and be part of that conversation. Thank you. That's all from me.
Thank you, and we think we might have our last questions from our attendee, Johi, and please, you can unmute your microphone now.
Hello. Thank you for the presentation. My question is to Professor Diane. Because I'm from Nepal, so health literacy, the concept of health literacy is quite new already in Nepal. So how can we incorporate like digital health literacy? How could we make it more feasible to, adopt digital health literacy in a country like ours? If you could give us some ideas.
I would have to learn a little bit more about what's going on in Nepal, but thank you for the question. I believe that it's really important for, depending upon what your position is and depending on what you do, I really would recommend going forward step by step. First, learning about what people's digital health literacy is. For example, the study that we did is very easy to apply. We've asked people how difficult or easy it is for them to access information digitally, to use resources, to be in touch with their provider. And a whole series of questions, and we're very happy to share in the international report. We published the international report, and you can just go online and Google, and the international report for MPOHL, M-P-O-H-L. I can put it in the chat. And it was published in December 2021. You'll see even the tools there, the questions. It's very friendly. And we're not testing people. We're asking them how easy or difficult it is for them. And from those answers, you can do it to your in a community. You can do it nationally. You can do it in a workplace. We know how people feel about the way in which they can use digital tools. And from there, you can move on to intervention. If people are feeling comfortable, then they're probably using it. There's also questions about usability, what they're using. So I think the first step is to learn, is to listen to the public and to see what they say about digital health literacy. And then you can take it from there to improve health literacy, digital health in so many different ways, in training, in community workshops, in the healthcare system, many different ways you can do it. But first, I would just have a snapshot and see what the public says about their own abilities. That would be my first step.
Thank you. Can you give me the link on that box?
I will try to do it. If not, I will be sending it to our host, and they can send it on to the participants.
Thank you so much.
Yes, then please leave your email to the chat box so that we can forward that useful message to you. Okay, so before we conclude, let's summarize the main takeaway from today's discussion. We talk about the definition of health literacy and digital health literacy from WHO, the use of technology to improve people and organization for their access, understand, appraisal, and apply to their health and healthcare. And the concept of this digital health literacy in the Health Literacy Survey 2019 further involved the ability to formulate ideas and thoughts to health, and also the frequency to use those information to promote health. And then we learn how to measure it through the tool developed by the MPOHL. And we also discussed the social, cultural, and generational influential factors in a populational level. And those are, for example, age, financial, and leveling society. Most importantly, how to move digital health literacy forward by identifying the appropriate and innovative interventions such as apps on smartphone, tablets that can contribute to develop a critical digital health literacy skills. And by strengthening digital health literacy for all and prioritize populations, especially for those with financial deprivation, less education, and particularly among those elder people. And for those vulnerable population who may also adapt to the new technologies such as virtual reality or augmented reality. And also by incorporating high quality of digital health information in the health system, and by collecting more individual health data from the device to monitor our health, and by adapting behavioral change theory into digital tools and those innovative apps. So that brings us to the end of today's webinar, and we hope you found it informative and valuable. Thank you for your participation, and we look forward to seeing you in future sessions.
Thank you, Ruyi. Thank you, Professor Chang. Shesha, Ruyi. Shesha, Professor Chang. Sheshanya. Okay.
Thank you, Dr. Ruyi, and thank you for
Thank you very much.
speakers. Thank you, sir.
Thank you all very much.
Thank you.
Thank you everyone for joining us. Thank you. See you in the next webinar.